Hello, my name is Dr. Diwan S. Raja. Today I will discuss multiple choice questions on contact dermatitis. We have two types of contact dermatitis, allergic contact dermatitis and irritant contact dermatitis. Let's start. Question number one, a 32-year-old woman presents with pruritic erythematous plaques on both hands that developed 2 days after she started using a new dish soap. She has no fever, systemic symptom. On examination, there is oil demarcated vesicles on an erythematous base localized on the dorsal surface of her hands. What is the most likely diagnosis? Atopic dermatitis, allergic contact dermatitis, irritant contact dermatitis, dyshydrotic eczema, psoriasis. Our answer should be allergic contact dermatitis. We have the vesicle and we have history of exposure to a substance to which she is allergic. She has exposure 2 days back using a new dish soap. She has no fever systemic symptom. Our answer should be allergic contact dermatitis. Second question. A 45-year-old man who works in construction presents with dry, cracked, erythematous skin on his palm and finger. He wears gloves for most of the day. There is no vesicles or systemic symptoms. The condition has developed gradually over months. What is the most likely diagnosis? Psoriasis, irritant contact dermatitis, allergic contact dermatitis, tinea minuum, systemic lupus erythematosus. Answer should be irritant contact dermatitis. Here, skin is dry, cracked, and erythematous, no vesicles, and he is exposed for a long time. Okay, so with dry, cracked, erythematous skin on his palm and finger, the conditions develop gradually over months. So answer should be irritant contact dermatitis. B is the answer. Question number three. A 22-year-old college student developed a linear erythematous vesicular rash on her forearm after hiking in the woods. She recalls brushing against some plants. What is the most appropriate initial management? Systemic corticosteroids, oral antibiotics, topical corticosteroid, antihistamine alone, phototherapy. Answer should be topical corticosteroid. C. Question 4. Here, a 29-year-old woman with a history of atopic dermatitis develops worsening hand dermatitis after using latex glove at her hospital job. Patch testing reveals a delayed hypersensitivity reaction to latex. Which immune mechanism is involved? Type 1 hypersensitivity, Ig mediated, type 2 hypersensitivity cytotoxic, type 3 hypersensitivity immune complex, type 4 hypersensitivity T cell mediated, autoimmune mediated destruction. Answer should be D, type 4 hypersensitivity, T cell mediated. Question number 5. A patient with no nickel allergy develops pruritic skin rash under her belt buckle and around her earring sides. What is the best way to prevent recurrence? Use topical antihistamine prophylactically. Apply emollient daily. Replace metallic accessories with plastic or stainless steel. D. Take oral corticosteroid before exposure. E. Avoid soap and fragrance. Answer should be C. Replace metallic accessories with plastic or stainless steel. So, nickel is one of the important cause of allergic dermatitis. There is a lot of pruritus, and this metal is notorious to cause allergy. So it should be replaced with metallic accessories with plastic or stainless steel. Okay. Now we'll go to the next question. A 36-year-old nurse presents with a 1 week history of itchy erythematous patches on the back of her hand. She recently changed hand sanitizer at work. Physical examination shows erythematous plaque with small vesicles and excoriation confined on the dorsal aspect of both hands. No other skin involvement is seen. Which of the following is the most likely diagnosis? A. Allergic contact dermatitis. B. Written contact dermatitis. C. Atopic dermatitis. D. Tinea menuam. E. Scabies. Answer should be what? Itchy erythematous patch, back of her hand. Okay. Some vesicles and excoriation. So it should be allergic contact dermatitis because of changed hand sanitizer. Okay. There is a reason. So allergic contact dermatitis. Question number 7. A 42-year-old woman presents with chronic dry, thickened and fissured skin on her hand. She works as a hair salon in a hair salon and often handles shampoos and dyes without gloves. The rash is non-vesicular and involves the palm and finger. There is no history of new product exposure or systemic symptoms. What is the most likely diagnosis? A. Psoriasis. B. Allergic contact dermatitis. C. Irritant contact dermatitis. D. Seborrheic dermatitis. E. Lichen planus. Answer should be irritant contact dermatitis because thickened, dry, fissured skin and long history of exposure to the irritants. So it is irritant contact dermatitis. C. Question number 8. A 25-year-old man presents with linear, intensely pruritic rash on his left leg that began 2 days after hiking through a wooded area. On physical examination, there are vesicles and erythematous stick. Which of the following features most strongly support a diagnosis of allergic contact dermatitis? A. Pruritus without vesicle. B. Rapid onset of symptom within hours of exposure. C. Lesion in a linear distribution. Positive family history of eczema. E. Negative potassium hydroxide preparation. So here most likely this is the answer. Lesion in a linear distribution. Exposure to poison ivy or poison oak, we may get this lesion in a linear distribution. Okay. Question number 30. Question number 9. A 30-year-old woman presents with an intensely pruritic rash on her neck and wrist after wearing a new necklace and bracelet. Physical examination reveals erythematous plaque and vesicle and excoriation in areas where jewelry made contact with the skin. She has no systemic symptom. She has taken off jewelries. What is the most appropriate initial treatment? Okay. Initial treatment should be topical corticosteroid and the offending agent should be removed. And we use the topical corticosteroid C. Question number 10. A 45-year-old janitor presents with chronic dry, cracked, and scaly skin on his hands. He reports frequent exposure to cleaning chemicals at work. He has tried using hand lotion with minimal relief. What is the most effective strategy to improve his condition? A. Begin oral corticosteroid. B. Prescribe oral antihistamine. C. Recommend daily hand washing with antibacterial soap. D. Prescribe systemic antibiotics. E. Advise strict avoidance of chemical exposure and use of protective gloves. Answer should be E. Adverse strict avoidance of chemical exposure and use of protective gloves. Okay, that's all about the MCQs on the contact dermatitis. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.